Afternoon, everybody. I will be very, very, very brief. First thing I wanted to say was, if you think back to when councils were first created, their raison d'etre was around public health priorities. It was about improving public water. It was improving working standards, etc. It was also about improving sanitation. And clearly we've got a way to go in COSLA to make sure we've got functioning toilets. So thank you for bearing with us this afternoon. Fortunately, we've now got a much more sophisticated approach to how we look at public health and the delivery of public health outcomes. I've been given the task of reminding us of everything that we said this afternoon, and clearly I'm not going to do that in 30 seconds, so I'm just going to pick out some of the highlights of today. So Angela, you started off reflecting on the perfect storm of challenges and opportunities for public health. And to address that, we need a different style of leadership. You talked about it being a system leadership, a more collaborative style of leadership, which moves us into territory where relationships are much more important than structures. And also that actually we need to give some away in order to develop those relationships. The challenges of public health can't be solved by one organisation or sector, and it was fantastic to see so many people from different backgrounds on the panel there, and that the outcomes can only be delivered by a whole system approach. Paul gave us an insight into England's experience and their approach. He reflected that public health is a core local government territory and thought that we had a real opportunity in Scotland to connect local democratic accountability to public health in its widest sense. He reiterated, and it's a theme of today, it's about how we lead and not structures. He told us about how the public health outcomes are at the heart of what he and his council do, and that no doubt, and I heard you saying there, Angela, that SBC, Scottish Borders Council, had got a hold of their toolkit. I'm sure there'll be others who will no doubt get in touch with Paul to get a hold of that toolkit. And I think the big message from Paul was this is a corporate agenda, a full agenda for the council. Jamie talked about leading change and complexity, and that complex systems have an immune response to change. And instead of thinking about change in a linear form, we should think about it in an iterative way. And that approach would act as an antidote to the change antibodies. See what I did there? Yeah. He noted that local government has a unique contribution to make, and how the approach that he called helping it happen, I think we call it co-production, is much more successful. Reflections on the panel, there are too many really to reflect on, but the key things that I took out of it is just how each part of it, there's an interdependence in terms of public health. And you could, at your point, Andrew, you could have put other services on the panel and shown that the role that they play in terms of public health delivery of outcomes. And I suppose it just shows the vast amount of things that we do as councils to deliver on public health. I think what came over strongly is the social economic factors, one of the biggest determinants of health. That health and well-being, inclusive growth, local and development planning, environmental health, etc., are inextricably linked to public health. Just a couple of observations from me, and then I'll shut up. The task ahead is no doubt difficult, it's challenging, but that the outcomes, I think, the outcomes that were published last week, I think give us a real opportunity to come together and look at how, across a whole system, we can deliver on outcomes. Many times today, I think we've heard that bit about collective leadership, collaborative leadership, a different style of leadership. And I suppose a reflection from me is that doesn't happen on its own. That needs investment for it to happen, because it is a different style of working. The task ahead for COSLA, as the membership body for local government and Scottish Government, I think, is to make sure we create the environment for people at a local level to do what you need to do. The task ahead for councils is in leading the way in working differently with your partners, with all our partners, putting into practice that collaborative system, that leadership which featured highly in today's discussion. I think the other thing that came out for me is a focus on relationship development and that actually that's at the heart of so many of the things that we do. You can look at structures, you can look at processes, etc., but actually it's about building the relationships at national and local level in order to be successful. And I certainly feel as if coming into the rooms today, that's taken us a wee step further in relation to all the discussions that we've been having. So can I thank everybody for coming? Can I thank you all for your participation? Can I thank Angela for the role that you've undertaken today, but not
feels miserably,
and all the speakers and the participants on the panel this afternoon. So I'll briefly hand over to Angela for next steps.